Hello, welcome back to the channel. This is my 14-week update for the Lenire device treatment for tinnitus. And I'm going to put a slash on this. This is slash information about the tongue tip for the device. If you've been following my channel, I've been doing a weekly update from my very first day of use of Lenire, and I did a weekly update through my whole 12-week process with the device. And now I'm kind of backed off to doing a video basically every 2 weeks to kind of give you guys an update, because I am having to continue on. 12-week wasn't enough for me to get to a comfortable spot with my tinnitus. And I did my 12-week follow-up with my audiologist after I made my 12-week video a couple weeks ago. I ended up having to reschedule with her. I didn't usually try to get that meeting done before I made my video for you all, but it didn't happen on that 12-week. I actually talked to her really close to my 13-week use of the device, and I got a little information from her. You know, she said for people out there that's using the device and, you know, that are not seeing the results they want to see at 12 weeks, you know, they really shouldn't be discouraged. You know, she said the 12-week mark was something Lenire had to do to get FDA approval. You know, FDA required them to get in there and show that there was some type of improvement in a short amount of time before, you know, FDA would have gave them any type of approval. They couldn't basically, I guess, go in there and say, you know, this device needs 6 months or a year for FDA to work with them, according to her. She said, you know, they needed a shorter time, and so Lenire ended up choosing the 12 weeks because they knew, you know, in their testing, patients were seeing improvement in 12 weeks. And so she said, you know, a person shouldn't feel like if you use this device in 12 weeks, if you're not, you know, getting better, that it's not going to help you, you know. And she said, especially if you're seeing improvement. And, you know, and for me, I am seeing some improvement. Like I said, I've probably, according to my testing and everything, I'm seeing about a 15% improvement from beginning of use. You know, is where I was at my 12-week follow-up. You know, 15% is something. It's not nowhere near where I need to be. I'm still not at a comfortable noise range, you know, in my tinnitus at 15% better. You know, like I told her when I bought the device, I really knew I needed to see a good 50% decrease in the volume of my T to be what I feel a comfortable area, you know, and I'm not there yet. But if the device will keep bringing it down, you know, I'm planning on doing another 12 weeks with it, which, you know, would be a 24-week total. You know, so say at 24 weeks, if I feel like, or the testing shows I'm 30% better, well, that shows you I'm gradually getting there. You know, I'm not saying I'll be 30% better at 24 weeks. I don't know where I'll be, but I'm going to try it. You know, I'm going to continue on. And so I wanted to share that with everybody out there. If, you know, if you're using the device now and if you're not seeing the results you want to see, you know, it's 12 weeks isn't the cutoff date for this device. It was just something Lenire had to use to get approval and to show improvement. And, you know, like I said, she's had quite a few patients that has, you know, got to a level that they quit using the device after 12 weeks. They were, you know, at a real comfortable level and they've stopped. And she's got other patients that's having to continue on. And like we've talked about, it depends a lot on how bad your tinnitus is, I feel, on probably how long it's going to take. But something I learned speaking with her, and I've kind of learned on my own, I feel, to a point too, with this device. And I want to share this if you're using the device or you're thinking about buying it. And that is, I believe personally that the power setting for the tongue tip is a very crucial thing for each individual patient on their track to getting better. And why I say that is because where I was at, where they set the power setting when I bought the device in her office, as if you followed my videos, I told you I felt that the power setting was too low. It didn't feel very stimulating on my tongue. And so at week 9, I believe you can go back and watch the week 9 video. I think it was right in there. We upped the power on it. She helped me recalibrate it. We do everything virtually because she's a good distance from me, so we do everything virtually. But she helped me recalibrate the device at week 9. And we basically turned the power setting up 2 power settings. And from week 9 all the way to week 12, which would be a 3-week span, I did not no longer get any breaks from the device. If you follow my videos, I was telling people, sometimes I could take the device off and I would get this 5, 10, 15-minute break where my tinnitus would really drop low. As soon as I pulled the device off from doing the 30-minute session, I would get this nice break, and even one of them lasted for like over 3 hours. Well, I quit getting those after we turned the device up, and I didn't see any more improvement. I actually felt like my tinnitus was going back to getting louder for those 3 weeks that we cranked the device back up. And so right after I made my 12-week video, a few days after, because I was getting ready to speak to the audiologist again, but I was really going through a hard time again. So I actually turned the device back down 1 power setting. Like I said, we went up 2 power settings, and I went back down 1. And I've been on that next power setting down there for ever since the 12-week video. So for a couple of weeks now, I've been on it. And I'm actually still not seeing the breaks like I was. So I may need to go back to my original power setting. But I want to discuss that power setting real quick so you know what I'm talking about. On this device, I'm going to use my pen here and point. When you're sitting in the office and they're setting this up for you, this little, right here, little bar is going to light up green. And then they're going to put the tongue device in your mouth, and they're going to start asking you, let me know when you feel the stimulation. And they're going to start hitting the power setting over here, 1 at a time. And every time they hit 1 at a time going up, this next bar right here is going to light up purple. And I'm going to call that power setting 1. They don't call it that. This is just something I'm telling you as a guide. And then you're more likely not going to feel any stimulation on 1, so they're going to hit it again. And then the second bar will light up. And then if you don't feel the stimulation, you shake your head no, then they'll hit it again, then this third one, and so on and so forth. Well, for me, in the office setting, it took to right here, which I'm calling power setting 4, it's the 4th bar, 1, 2, 3, 4. This is where I started feeling stimulation, and that's where they set it. Now, back then, she was very new at this device, and I don't really think they was writing down how many lights lit up to people's power setting. And then your audiologist you're using, or if you go get this, if they're not doing this, you might want to mention it. However many of those lights it takes for you to feel that stimulation, you need them to document that. Like I said, for me, I just happened to watch and pay attention. I was at 4. Now, at 9 weeks, when I felt I was wanting more power, I went ahead and skipped 5 and went to here. 6 is where we locked it in at. I'm going to call it power setting 6. But as I said, 6 has not helped me a bit. And so, again, right after week 12, I've backed it off to what I'm calling power setting 5 right here. But again, I'm still not seeing any results here at 5. So I'm really curious if I need to go back to power setting 4. And again, Lenire's not calling these power settings 1, 2, 3, 4. I'm doing this. But like I said, this is still really new for everybody, and it's something people have to understand. And everybody's tongue has got different sensitivity in it. And that's why they do this in the office instead of just having 1 power setting. They're sitting there and going through, barely giving this thing some juice until you feel a buzz on your tongue, because, your stimulation on your tongue could be different than mine. Everybody's got different nerve endings and more nerve endings than others. And that's why they do this. And it's a great thing that they do. And wherever they set you at, like for me here, I was on 4. Once they lock that in, like I said, you still on the side here of the device, you've still got, when you run the device at home, you've still got a power setting here where you can up the power a little bit higher or lower it down. When I was on 4 for all those weeks, I end up at night and day both would run this to the highest point that it would allow you on this side to give it, because again, I wasn't feeling much stimulation. But I'm actually, just reviewing myself, I feel like I'm getting better results with it on a lower power. And my doctor or audiologist actually said, that she's seen 1 patient so far that she's seen as a fact that if the power setting is too high, they wouldn't get any results, and she had to, lower the power back down. So we've seen that now in a couple people, including myself. And so, this is a good tip for you guys out there. If you're using the device, if you're not seeing any results, and I'm not saying if you've just been using it for a few weeks, I think a person probably better try to use it for at least a month or 2 before you start adjusting. But, if you're a good 8 weeks in and say it's just, worse and worse, talk to your audiologist about cranking the power setting down. Or if anything else, definitely, on your own, do all of your 30-minute runs with you manually turning down the power on the tongue tip as low as you can go, and just see if that might help you. And again, this is just a tip. I don't want to change you up and, tell you the wrong thing, but I'm just telling you something I've learned for myself that could, in fact, help you, help others. And so, but I believe there's a fine key there with the power of that tongue tip, as crazy as that sounds. But that's what's supposedly running in parallel to your brain with the sounds in the headphones, as they say that the two main nerves from your tongue and your ears run parallel together to the brain, and that's where they're getting that this tongue tip thing works, and how it's supposed to work, how it's supposed to help the tinnitus. And I believe that it does, but I believe there's a key feature there of getting the power just right for each individual. And like I said, what power setting works for me definitely isn't going to work for you, or so on and so forth. Like I said, we're all different. Our bodies are made up different, I believe. So, but it's something I believe you could really take time and try to, figure out for yourself. But I guess the main takeaway is make sure you don't feel like it's too stimulating. I feel like the lighter the stimulation, the better it works. And you would think it would be just the opposite. That's why I wanted to crank mine up at week 9, because I felt like the more stimulating that tongue piece was, probably the more it would help. But I don't believe that's the fact. So anyhow, I just wanted to share that with you guys. For myself, here at 14 weeks, I'm still doing, like I said, about the same. Nothing great. By no means has improved. One thing the doctor told me that was interesting, she said she has a patient that's at 16 weeks right now, that's going on and going to do, I think, a 24-week period like I'm going to do. And she said they're at 16 weeks, and she did a check-in with them the other day, and she said that they're seeing quite a bit of improvement at 16 weeks, which she thought was very interesting and very hopeful. So, she said, again, person don't need to get stuck on the 12-week thing, thinking, if you ain't seen something in 12 weeks, you're not going to make it or not going to get cured, because there's still the possibility of that. So, so I'm still hopeful, but like I said, I just want to share. I believe there's a lot of things to look at in that power setting for each individual on the path to getting cured. I think there's a lot in that power setting. So, keep an eye on that if you're using the device, or if you end up buying it. Try to not go too heavy on the stimulant. Try to stay on the lighter side and see if it don't improve if you're having troubles, because I don't believe you want a lot of power on that thing, just from what I'm seeing and talking to my audiologist. So anyway, I hope this helps everybody, and in a couple weeks I'll get back with another update. So thank you all for watching.